So for pediatric TBI, there are no currently available or accepted therapies for any part of the care of kids. So we're studying kids who are most severely injured, the ones who are unconscious after they were injured, who spend weeks in the hospital, sometimes months in the hospital. There are no currently available treatments that are accepted. The goals of our research are to look at a large data set of 1,000 patients across many different clinical sites to try to figure out which therapies are currently in use, which have the best association with outcomes. And this is called comparative effectiveness research. So our goal is to compare the effectiveness of 3 different types of therapies for intracranial pressure, secondary injury detection, and metabolic support. And those form the foundation of our project.
By including just children from the United States, you limit the generalizability of the results. There are certain treatments that are maybe more or less likely to be done in the US. By including centers from around the world, we include other types of interventions that may be done there, thus increasing the generalizability and allowing us to get a better assessment of what interventions are possibly beneficial to the children. We are collecting an enormous amount of data, and all the data we're collecting are essential to addressing the questions that Mike mentioned earlier. That said, there are an enormous number of secondary questions that are out there. We have limited time and resources, and those will be focused primarily on those initial questions. So the data will now be available for the scientific community to explore the data and address those questions and hopefully advance the field further.
So we hope that our study will form the basis of improved evidence-based guidelines. Currently, the evidence-based guidelines are so inadequate that we really can't make recommendations as to what therapies are best. We hope to expand those dramatically so that every clinician in the US and abroad can take a look at the data and see which the best strategies are. In addition, we hope that we can form the foundation of a clinical protocol that can be used for research studies to make the research studies have a chance of succeeding in the future.